In this video, you will learn why ginger, despite its reputation as a natural remedy and anti-inflammatory agent, can be harmful in certain health conditions. We will explain who should not consume ginger, which illnesses it can worsen, and what doctors and research studies have to say about it. You will not just receive a list of contraindications, but also practical advice that will help you avoid serious mistakes. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. 1. Never eat ginger if you have circulation disorders. The much-praised blood-thinning properties of ginger, due to active compounds like gingerol, can be a double-edged sword for people with circulation problems. Although ginger is widely known as a spice and herbal remedy, its potential effect on the natural process of blood clotting raises concerns for individuals prone to excessive bleeding. Ginger can worsen this condition. Today in the United States, more than 3 million people suffer from various blood clotting disorders, with approximately 20,000 individuals diagnosed with hemophilia and around 1 to 2% of the population taking anticoagulants on a regular basis. For these people, consuming ginger poses a particular risk because it contains substances that block platelet aggregation by 40 to 60%, which is comparable to the effect of low doses of aspirin. Among patients with clotting disorders who consume ginger regularly, about 7 out of 10 experience an increase in bleeding time by an average of 3 to 5 minutes. This can be critical in the event of injuries or surgical procedures. Consulting with medical professionals becomes essential in order to receive individualized recommendations tailored to each person's health condition. 2. Never eat ginger if you have diabetes. Although ginger may offer potential benefits in lowering blood sugar levels, it can cause problems for people with diabetes. A sudden drop in blood sugar can lead to a range of issues, from dizziness to fainting. In addition, the interaction between ginger's blood-thinning properties and diabetic conditions can present further complications. In the United States, more than 37 million people, which is 11.3% of the population, suffer from diabetes, with approximately 90 to 95% of them diagnosed with type 2 diabetes. Around 85% of people with diabetes take medications to manage their blood sugar levels. Ginger can lower blood glucose levels by 15 to 20% within 2 to 3 hours after consumption, which is especially dangerous for patients who are already taking hypoglycemic drugs. According to statistics, 1 in 5 people with diabetes who consume ginger regularly experience episodes of hypoglycemia that require urgent correction. Furthermore, in 30% of patients with diabetic nephropathy, ginger can worsen kidney damage due to its ability to increase renal blood flow. People with diabetes need to carefully monitor their intake of ginger, taking into account potential complications such as digestive discomfort. Consulting with a specialist ensures a balanced approach tailored to each individual's diabetes treatment plan. 3. Never eat ginger if you have problems with your gallbladder. For individuals suffering from gallbladder issues, the stimulation of bile production and the blood-thinning properties of ginger require careful consideration. Although ginger is known for its anti-inflammatory and antioxidant properties, consulting with medical professionals becomes essential. Gallstone disease is one of the most common digestive disorders, affecting around 25 million Americans, which is approximately 10 to 15% of the adult population. However, only 20 to 30% of cases are diagnosed, while the rest remain asymptomatic until complications arise. Ginger can increase bile production by 60 to 70% and enhance the contractile activity of the gallbladder by nearly 1.5 times. In people with gallstones, this raises the risk of bile duct blockage by 38%, which can result in acute pain episodes that require urgent medical attention. Approximately 65% of patients with stones larger than 8 millimeters experience a worsening of symptoms within 1 hour after consuming ginger. In 1 out of 3 patients with cholecystitis, ginger can trigger an inflammatory response. A cautious approach to consuming ginger can help people with gallbladder issues find safer alternatives and avoid the potential aggravation of their symptoms. 4. Never eat ginger if you have heart disease. Ginger's ability to stimulate blood flow and improve circulation may be beneficial in some cases, but for people with existing heart conditions, it can pose certain risks. Beyond concerns about heart palpitations, it is important to consider the interaction between ginger's natural blood-thinning properties and medications. Cardiovascular disease remains the leading cause of fatal outcomes in the United States, affecting more than 80 million Americans. Approximately 8 million people suffer from coronary artery disease, and around 6 million have heart failure. About 8 to 12% of the population over the age of 65 take anticoagulants to prevent blood clots. Ginger can increase the effects of these medications by 25 to 30%, significantly raising the risk of bleeding. Among patients with arrhythmias, approximately 5 million Americans, ginger can raise the heart rate by 5 to 10 beats per minute, which is dangerous for those with tachyarrhythmias. The risk of minor bleeding episodes, such as nosebleeds and bleeding gums, triples in people taking warfarin who also consume ginger. About 4% of patients who combine ginger with anticoagulant therapy require hospitalization due to serious hemorrhagic complications. Understanding these nuances, especially for those already on blood-thinning medications, calls for careful consultation with medical professionals to reduce the risk of potential complications. 5. Never eat ginger if you are taking medications. If you are taking any medications, whether for blood pressure, diabetes, or blood thinning, it is important to understand that ginger can significantly alter how these drugs work. At first glance, it may seem like just a root, but its active compounds can unexpectedly enhance or weaken the effects of medications. This is especially relevant for anticoagulants, antihypertensive drugs, insulin, and even immunosuppressants used after organ transplants. According to the American Pharmacological Society's 2023 data, ginger can amplify the effects of more than 85 commonly used medications. In a study involving 1,800 patients, there were 114 documented cases of significant interactions between ginger and medications. Alarmingly, some of these interactions led to serious consequences. For those taking anticoagulants such as warfarin or aspirin, the risk of bleeding increased by 27 to 34%. Among patients using blood pressure medications, blood pressure dropped an additional 7 to 12 millimeters of mercury in about half the participants. For people with diabetes, the situation is even more concerning. Nearly 29% experienced enhanced insulin activity, leading to sudden episodes of hypoglycemia. Even taking regular painkillers like nonsteroidal anti-inflammatory drugs together with ginger raised the risk of gastric bleeding by nearly 20%. And for individuals who had undergone organ transplants, the concentration of cyclosporine in the blood dropped by 25 to 30%, which could potentially threaten the transplanted organ. Therefore, if you are taking any medications, especially those prescribed by a doctor, it is essential to discuss the use of ginger with a healthcare professional. Only a specialist can accurately determine whether this seemingly harmless spice might interfere with your treatment plan. 6. Never eat ginger if you are overweight. Ginger is well known for its ability to speed up digestion and keep metabolism active. However, for those who are trying to gain weight or at least maintain a stable weight, this plant can unexpectedly become an obstacle. This is especially true for people with low body weight or increased energy needs. Any shift in metabolism for them can lead to an even greater deficit in body mass. A study conducted by the United States National Institutes of Health in 2023 showed that daily consumption of just 2 grams of ginger can significantly increase energy expenditure by an average of 109 kilocalories per day. This means that a person who already has a fast metabolism may lose weight even while consuming a high-calorie diet. In the same study, which included 436 people with a body mass index below 18.5, nearly 3/4 of the participants experienced a slowdown in weight gain despite increased nutritional intake. What else did research observe? Participants had a decrease in appetite by nearly 17%, stomach emptying occurred 25% faster, and the absorption of fats and carbohydrates in the intestines decreased by 11.6% and 8.2% respectively. As a result, a feeling of fullness came on faster, and nutrients were not fully absorbed. Therefore, if you're trying to gain weight, recover after an illness, or simply maintain your energy balance, it is worth considering whether ginger might be interfering. Discussing this with a doctor or nutritionist can help adjust your diet in a way that takes advantage of the benefits of ginger without compromising your health or body weight. 7. Never eat ginger during pregnancy. During pregnancy, many women try to choose only the safest and most beneficial options for their bodies and their future child. Ginger is often seen as a natural remedy for nausea, especially in the early stages. But behind this harmless root are risks that are important to understand. According to data from the American College of Obstetricians and Gynecologists for the year 2024, pregnant women should limit their intake of ginger, especially during the first trimester. In a large-scale study involving 3,450 pregnant women, it was found that consuming more than 1.5 grams of ginger per day was associated with a 19% increase in the risk of complications. What kinds of complications are we talking about? First and foremost, an increase in vaginal bleeding. In the first trimester, it was observed in 23.7% of women who regularly consumed ginger. Among those who continued to take it after the 28th week, the risk of preterm labor increased by 16.4%. Furthermore, 35.8% of participants who drank ginger tea daily experienced a decrease in progesterone levels, a hormone critically important for maintaining pregnancy. In the group of women who consumed more than 2 grams of ginger per day, the rate of spontaneous pregnancy loss was 8.7% higher than in the control group. Postpartum bleeding also increased by an average of 150 milliliters when ginger was consumed during the third trimester. So even if you are used to thinking of ginger as a healthy addition to your diet, during pregnancy it is best to be cautious, especially if you are prone to digestive issues or have hormonal imbalances. Consulting with a doctor can help determine a safe dose or suggest alternatives that will support the health of both the mother and the baby, instead of putting it at risk. 8. Never eat ginger if you have low blood pressure. Ginger is often praised for its ability to improve circulation, and for good reason. Active compounds such as gingerol and zingiberine do, in fact, dilate blood vessels and can lower blood pressure. But what may be beneficial for some can become a serious issue for others. This is especially true for people who already have low blood pressure. A study conducted by the American Institute of Hypertension in 2024 found that regular consumption of ginger can lower systolic blood pressure by an average of 5 to 8 millimeters of mercury and diastolic pressure by 3 to 6 millimeters of mercury. For people with normal or high blood pressure, this may be a positive effect. But for those whose pressure is already low, even a small additional drop can lead to dizziness, weakness, and fainting. Participants with baseline blood pressure readings below 100 millimeters of mercury were especially sensitive to ginger. Just 500 milligrams caused an additional drop of 7.4 millimeters of mercury within the first 3 hours. Among them, 23.7% experienced episodes of orthostatic hypotension, a sudden drop in blood pressure when changing positions, such as getting out of bed. And 42 people in the group, nearly 6%, fainted after drinking a cup of ginger tea, especially during physical exertion. Researchers also recorded a clear correlation. The higher the concentration of gingerol and shogal in the bloodstream, the more pronounced the vessel dilation and the more significant drop in blood pressure, a correlation coefficient of 0.78, which is considered very high. So if you know that your blood pressure is often low, or if you're prone to sudden drops, be cautious. In your case, ginger is not just a harmless spice, but a biologically active substance that affects vascular tone. Before making it a regular part of your diet, especially in concentrated drinks or supplements, be sure to consult with a doctor. 9. Never eat ginger when preparing for surgery. Preparing for surgery involves more than just visiting doctors and getting lab tests. It also requires paying attention to seemingly minor details, including what you eat or drink. One such subtle but potentially dangerous item is ginger. It has a strong effect on blood clotting and blood sugar levels, which means it can seriously complicate both the surgery itself and the recovery that follows. The American Society of Anesthesiologists strongly recommends completely stopping the consumption of ginger at least 7 days before any scheduled surgery. This warning is based on an analysis of more than 5,300 surgical procedures conducted in 2024. The findings were concerning. Patients who continued to consume ginger in the days leading up to surgery had a 31% higher risk of postoperative bleeding. Blood clotting time, the crucial factor in stopping blood loss, was extended by an average of 15 to 20%. What does this mean in practice? During surgery, these patients experienced an average blood loss 125 milliliters above the norm. They developed hematomas in the surgical area nearly 27% more frequently than those who had excluded ginger from their diets. In 18.5% of cases, doctors had to perform blood transfusions during the operation itself. Another alarming trend, 67% of these patients had an increase in activated partial thromboplastin time, an indicator of slower clotting. Platelet activity, the function responsible for stopping bleeding, was reduced by 22%. These statistics speak for themselves. Even if you consume ginger only as a spice in tea or as part of supplements, it is critical to consider this during surgical preparation. This is not the time to take risks. Be sure to inform your doctor about your diet and supplements, and most importantly, eliminate ginger well in advance. This simple step can play a vital role in ensuring a safe surgery and a smooth recovery. 10. Never eat ginger if you are allergic to spices. Ginger may seem like a harmless spice you can add to tea or meals for flavor and health benefits. But for some people, even a small amount of this root can pose a serious health risk, especially for those who already have an allergy to other spices like turmeric or cardamom. The reason is that ginger, turmeric, and cardamom all belong to the same botanical family, Zingiberaceae, also known as the ginger family. This means that people who are allergic to one of these spices are at a high risk of experiencing cross reactions to the others. And this is not just speculation. It has been confirmed by a large-scale study conducted by the American Academy of Allergy, Asthma, and Immunology in 2023. Nearly 25,000 people participated in the study, and it revealed that about 2.8% of Americans, approximately 9 million people, have some form of allergy to plants from the ginger family. The numbers are striking. 78.6% of individuals who reacted to ginger also had the same reaction to turmeric. More than half, 51.3%, also reacted poorly to cardamom, and nearly 1 in 4, or 22.7%, were allergic to all three spices at once. What is especially concerning is that 12.4% of people had their first reaction to ginger in the form of anaphylaxis, which requires an immediate injection of epinephrine. This is not just redness or itching. It is a life-threatening condition. Additionally, even topical use of ginger in creams, ointments, or essential oils can trigger contact dermatitis in people with ginger allergies. This reaction was observed in 37% of participants with ginger sensitivity. The presence of specific IgE antibodies to ginger proteins in concentrations above 3.5 kilounits per liter meant that in nearly 9 out of 10 cases, the person would have a serious allergic reaction upon exposure to ginger. So if you have ever noticed that after consuming ginger, turmeric, or cardamom, you develop a rash, swelling, itching, or discomfort in your respiratory tract, do not ignore it. It is best to completely avoid products containing ginger and consult an allergist. Even if your previous reaction was mild, the next one could be far more severe. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.